This week's reports about the Trump administration's new immigration and visa health guidelines have ignited a fierce debate about fairness, discrimination, and what it means to welcome people into the United States. According to KFF Health, News, and People magazine, the State Department has quietly reinstated a version of the controversial public charge rule, which allows consular officers to deny visa applications based on an applicant's potential future health costs or reliance on public benefits. Under this new guidance, consular officials can deny visas to immigrants they believe might become a financial burden on the U.S. health system, and in practice, that includes individuals with certain chronic conditions or disabilities. What makes this move especially contentious is that, according to the reports, the policy has been applied in a way that disproportionately affects applicants with obesity, diabetes, or other long-term health conditions, effectively treating those health statuses as red flags in the visa process. People magazine reported that applicants have already started receiving denials under these guidelines, sparking accusations of discrimination and moral outrage across social media. From my perspective, this policy reflects a troubling shift in how health and immigration are being linked, and not in a way that prioritizes compassion or fairness. The underlying logic of the policy is that the U.S. shouldn't issue visas to people who might use public health resources or require long-term medical treatment at taxpayer expense. On paper, that might sound financially rational, but in reality, it reduces human beings to actuarial risks. It's a dangerous precedent to set because health status is often determined by circumstances beyond one's control, genetics, socioeconomic factors, or simply where someone was born. It's also worth remembering that the majority of visa applicants already undergo rigorous health screenings and are required to show proof of financial stability before approval. Denying someone based on weight or a chronic condition like diabetes implies that their worthiness to enter the country is tied to an arbitrary metric of physical health, not character, skill, or contribution potential. In a country that already struggles with health equity, this policy feels like it punishes people for being human in the most literal sense. KFF Health News points out that this latest change echoes earlier versions of the public charge doctrine first introduced under the Trump administration in 2019, which faced widespread backlash and legal challenges before being rescinded in 2021. Back then, critics argued that it discouraged immigrants from seeking medical care or applying for basic benefits, even when they were legally entitled to them, out of fear it might hurt their immigration status. Now, with this renewed guidance, many health advocates worry that the same chilling effect will return, deterring immigrants from getting preventive care and worsening health outcomes in vulnerable communities. What's particularly striking is that this time, the policy isn't just theoretical. It's already being enforced in consulates abroad, meaning people are being told, in essence, you're too expensive to admit. The People article describes several instances of otherwise qualified applicants, including those with degrees and job offers, being turned away solely because of medical notes mentioning obesity or chronic conditions. In my opinion, this move also sends a damaging symbolic message that the U.S. values the young, healthy, and profitable over the diverse and real. It contradicts the nation's image as a place where opportunity outweighs circumstance. Imagine being an immigrant who studied for years, secured a job offer in the U.S., and then being denied because your BMI is above a government threshold. It's hard not to see that as dehumanizing. The policy risks normalizing a hierarchy of bodies where physical appearance and medical history determine worthiness. And the irony is glaring. America itself faces an obesity crisis, with nearly 42% of adults classified as obese, according to CDC data. If obesity disqualifies someone from contributing to the U.S., what does that say about how we view our own citizens? Another issue is enforcement. These are consular decisions made overseas, and they're largely discretionary, meaning individual officers have significant leeway to interpret what counts as likely to become a public charge. That opens the door to bias, inconsistency, and abuse. Someone with mild obesity in one country might be denied, while someone with more serious health issues in another might be approved. It's a policy that, in practice, will be impossible to apply fairly. Health experts quoted by KFF also warn that the rule misrepresents how healthcare costs actually work. Immigrants, on average, contribute more in taxes than they use in public services, including healthcare, and they are less likely than you, as born citizens, to use public benefits. In other words, the fear that immigrants will bankrupt the system isn't backed by evidence. It's based on perception and politics. I think what makes this situation even more concerning is the broader message it sends globally. When the US begins filtering immigrants by medical criteria that include something as common as weight or diabetes, it legitimizes a kind of medical discrimination that could easily spread. Other countries could adopt similar standards, deepening inequity and reinforcing the idea that people with chronic health conditions are less deserving of opportunity. It's a slippery slope that edges dangerously close to eugenic-style thinking, selecting the fittest and excluding those deemed imperfect. To me, this contradicts the moral and historical identity of the United States as a country built on the contributions of people from every background, including those who arrived with hardships and health challenges. In conclusion, while the Trump administration's new visa health guidelines are being justified as a way to protect taxpayers and the healthcare system, I believe they reflect a deeper misunderstanding of what makes a nation strong. A country's greatness isn't measured by how perfectly healthy its immigrants are, but by how fairly it treats them. Policies like this may save a few healthcare dollars on paper, but they cost far more in humanity, equity, and reputation. Turning away qualified, ambitious people because of weight or medical conditions doesn't make America stronger, it makes it smaller. And as this policy unfolds, it's going to test whether compassion and fairness still have a place in how America defines who belongs.